Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get See Me for this episode by clicking on the See Me link in the show notes. Today, we welcome Shan Liu. She's an emergency physician, co-author of Masked Hero. Today's KevinMD article is Dependent on a Mask My Great-Grandfather Invented. Shan, welcome to the show.
Thank you so much, Dr. Fo. It's such an honor to be here and to speak with you.
So let's start by briefly sharing your story and journey.
So I am an emergency medicine physician at Massachusetts General Hospital and have loved emergency medicine my whole career. And basically during COVID, as you know, we were on the front lines in the emergency department. And I grew up with this story about my great-grandfather being the inventor of the first respirator, or the reason why we wear masks during epidemics and then certainly pandemics. And so during that time when America was like debating about what kind of mask to wear or who should wear them, I wrote a couple pieces like for CNN and US News and World Report about my great-grandfather because I just felt like everyone should know this story. And fast forward, during lockdown, my first grade daughter, didn't have a lot of structure because I was her mother teaching her and homeschooling her.
Yep.
And we put her on an online writing class, and one of her assignments just was to write about a nonfiction, about a person. And so at that time, I said, you should really know about your great-great-grandfather. And during all of that racial tension in that time, I said, I looked at her and I said, we really should just do this. There's not a lot of books out there for kids that feature Asians, and much less East Asians and East Asians as heroes. And I felt like that was my way to address the racial tension that was happening and all the Asian hate crimes that were happening. And so the book formed from that.
All right, so we're going to talk more about your book and your KevinMD article. So tell us a story of your great-grandfather.
So my great-grandfather was born in Penang in Malaysia and he knew he wanted to be a doctor from a very young age and went to England to train and was the first person of Asian and Malaysian descent to graduate from the University of Cambridge with a medical degree. So he stays there, studies infectious disease and tropical diseases, and then goes back to Malaysia and actually had to endure a lot of racism. You could only get a position in some of these, even though Malaysia was a colony, unless you were of European descent, even though they were part of the British colony. So he ends up ultimately doing private practice and then leaving to go to China to work in medical education at one of the new medical schools there. And eventually, because of his training, was recruited to northern China to deal with this mysterious plague and he's 31, he does the first autopsy in China and basically finds out that it's a it was Yersinia pestis, and it was basically being spread through, respiratory droplets rather than through rats, what they had traditionally thought the plague was spreading, in terms of like their spread. So ends up saying, okay, we have to separate people, we have to isolate them, we have to quarantine, we have to wear masks. And originally, people wore masks for very different reasons up until that point. But this was the first time somebody implemented wearing a mask to prevent the spread of respiratory diseases, and ultimately has people invent the forerunner of the N95. And within 4 months, among other measures like isolation and really shutting down the whole city, the plague is ended in 4 months. So he goes on to manage the public health system in China and really implement sort of more modern measures to medicine and to public health there, and then ends up being the first to earn a nomination for the Nobel Prize in Medicine, first person of Asian descent and first person from Malaysia to win that. And so yeah, that's the story that I grew up with. And it was really personal during COVID to depend on the mask that he actually invented 100 years prior.
So back in the early 20th century, what was public health like then in China, and what was infection control like then before your great-grandfather arrived there?
Yeah, so pretty much not much was being done from a public health standpoint, or even from for lack of a better word, sort of modern or typically thought of as Western medicine, because people hadn't been trained and brought it back to China. So he started all of these measures. He started like the public health, public health service, things like they attribute the lazy Susan to my great grandfather, not as something you do in a restaurant, but really as a public health measure. So don't share your utensils, your chopsticks with other people, and have basically common
Yeah.
use, utensils at the table, and then had this lazy Susan as a means to facilitate that rather than everyone just sharing each other's meals and utensils. So yeah, pretty much there wasn't this public health system. There wasn't this like germ theory of like, preventing spread of disease. And he really walked in sort of, and at that time, China had gone through an incredible
Yeah.
change politically. It went from, being in the empire and the emperor to, some political, change in the political scene.
Sure.
So very different sort of world back then.
So he invented the precursor to the N95. Tell us more about that. How did he create it? Tell me what kind of materials he thought about in terms of bringing that precursor to the N95.
Yeah, thank you. Great question. So up until that point, masks could be, the typical mask was worn for either cultural, festivals and things like that. So you think of like people wearing masks for decorative issues, or they were wearing them sort of to prevent the spread of like in the Middle Ages, like smells and how they thought that
Yeah.
diseases were being spread then. But really, he's the first to recommend people wear this so that germs are not being spread when people cough or when they breathe near each other. So he invents called the Wu mask, and it's made of cotton and cloth, and it's just this like huge thing that just covers your entire face. And it's really the mechanic, like the N95. It prevents germs from being spread through mechanical methods, right? So
Yeah.
like if it hits one level, then it bounces around, and hopefully you have enough layers
Yeah.
that the germs and don't get to the person wearing the mask, or it's not being spread as well. So at that time, it's not like you had, factories. They basically had to use what they had on hand and figure out like, okay, we have gauze, we have cloth. Let's just like figure out a way to like prevent this from being spread, you know, between people. So it's really out of duress, right? It's really
Yeah.
out of like the need because it was nearly 100% fatality rate that you had to come up with these methods to prevent the spread.
So early on in his career, you mentioned that he encountered episodes of racism that certainly resonates with the racism that Asians faced during the pandemic. Tell us more about the racism that he faced.
Yeah, so great question. So he one was, being of Asian descent or Chinese descent, he couldn't, even though was trained in England, he couldn't get certain jobs in Malaysia, even though it was
Yeah.
Malaya at that time. But even though he had the credentials, he simply couldn't and he was of the British Empire because he was of Asian descent, and so literally couldn't take a post in Malaysia because he wasn't of European descent in the British colony or in the British Empire. So that was one episode. He also, when he went to Harbin or to northern Manchuria, there are a lot of other people from France, Russia, Japan, also in the area because there was a lot of it was a big trading post, and so there was a lot of political interest in that area because of how it crossed, because of a trading, it was
Yeah.
a epicenter of like trade. So a lot of people were interested in controlling that area. So you have a lot of influence from a lot of different powers there. So there were like Japanese, like I said, Japanese, Russian, French, European physicians in the area. And when this plague comes out, everyone comes and's like, what's going on? And they all have their different theories. And typically up to that point, the plague was, as I mentioned, spread through rats. And so that's how they wanted to control this epidemic, by basically dealing with the rats in the city. And my great grandfather basically says, no, I did this autopsy, and based on germ theory, that's not going to work if you try to control the rat population. We really need to control people from spreading it to one another. And the reason why he figured that out is because physicians were going to see patients and then dying right after. And
Yeah.
he knew that they weren't getting exposed to rats and fleas necessarily. And that's basically why he ended up going down a different pathway and figuring that out. But there's this famous sort of story where this Frenchman comes to him and he's like, you Chinaman. And so my great grandmother basically says like, no, we need to do it a different way. Like it's not spread through rats, it's spread through respiratory droplets. And the Frenchman says, you Chinaman, like how dare you defy me, or how dare you like question my authority? And then with basically this French physician goes on rounds, doesn't wear a mask, and the story basically ends that like a couple days later he dies. So that was sort of the triggering point for people believing that it was being spread in different methods.
Now, how did you hear about these stories from your great grandfather? Did you actually get a chance to meet him? How did these stories get passed down to you?
Oh, great question. So he fortunately wrote a autobiography before about a year and a half before he passed away. He wrote this long autobiography about his whole journey. And so that had been on my parents' coffee table in the living room just my whole life. And then it wasn't until college, which I mentioned in the essay, that I really go to China to just learn about what he had done. He ended up starting what's the equivalent of the AMA in
Yep.
China. And so it was their 80th anniversary. And as a kid growing up or in high school and college, it's like, oh yeah, okay, like these are stories, but they're not really real to me. And it wasn't until I actually went to China and just saw all of the things that they really were honoring him with, like really revolutionizing modern medicine there, did I really realize what he had done. And I wanted to go to medical school at the time. And so just really learned so much about him from my colleagues that I met at that conference. And then later on, we went up to Harbin in about 5 years ago with my children and my parents. And I was able to walk in the footsteps of where he actually did his work during the epidemic.
So you're an emergency physician, and of course, a lot of your great grandfather's stories resonated with you during the pandemic. So how did he influence your medical career?
Great question. So I don't remember a time that I didn't want to be a physician. I think my father is an engineer, and I think if he could tolerate blood, he would have become a physician. But he always shared these stories of epidemics and public health, and so I just don't remember a time I didn't want to do that. And I really was interested in public health, and it wasn't that he pressured us to do it. My sisters are not my two sisters are not even remotely related in terms of medicine. They don't do medicine. So it was really just something that I felt like, oh, that is fascinating. I it's such an honor to think about how do you help people on a public health scale to actually prevent disease. So I think it had a huge influence because I always had this idea that, like, oh yeah, there's besides just medicine, there's also thinking about the public health as a whole.
Sure.
And so I've always struggled with, you know, do you spend your efforts doing things at the bedside in emergency medicine, which is very much like one-on-one person, like affecting their lives, versus, do you spend more time in public health and try to prevent disease? And I think the two can marry, but sometimes you have to put your hat on for, you know, the bedside clinician hat versus thinking about public health in general.
Do you think that there's anything that we as a society today can learn from your great grandfather?
Oh, great question. Well, ironically, I think some of the same themes about masks. Well, I mean, we still debate masks today. Like 100 years later, a pandemic later, there's still just a lot of resistance and struggle about, how do you prevent disease? And not that I'm, necessarily wearing masks anymore after COVID, but that idea that we still had to reinvent a whole discussion about masks
Yeah.
a century later, you know, I think Asia pivoted so quickly for cultural reasons. So there's an article by in the New York Times by Christos Lanteris, who's an anthropologist
Yeah.
in Scotland. And he basically is like, the reason why Asians pivot so quickly to mask is because it's a sign of cultural, like, I believe in germ theory for one, and two, I care about my neighbor and other people in society, that I don't want to get them sick, and I don't want, I wear a mask to protect myself, but I also wear a mask to protect others. And there is still this like difficult stigma, I think, in the United States, that it's just isn't it's different, it's better after COVID, but it's still controversial. And there was so much controversy over, who should wear masks and when in our country, that it was interesting because I think in Asia, it's just sort of not even questioned, right? Like, oh, I just wear this because I don't want to get sick and I don't want to get you sick. And it really, that article that Dr. Lanteros wrote about was basically, it's a tip to, we believe in germ theory. We actually believe that, I'm going to prevent the spread of this by wearing something that's a small sacrifice. But yes, it's uncomfortable. We all know that it's not fun to wear masks, but we do it to protect others. So I think that's the lesson we can learn. And then, of course, I think that the general lesson in reading his story, even 100 years later, was that there is still a lot of just stigma and bias in terms of we can learn from other cultures. It doesn't, we can learn from other, Asia had been dealing with this months before, things really hit the United States. And so instead of reinventing the wheel, why can't we think about best practices that everyone's, people who are experienced can share with us? And what my great grandfather did right after the epidemic ended was that he organized the first international play conference and had people from all over the world come to China and basically say, like, we need to learn about this because these will happen again. And they did. They had these little epidemic breakouts of the plague for the next couple of years and instituted these measures to make sure that they got stamped out without it spreading all across the globe.
We're talking to Shan Liu. She's an emergency physician. She's the co-author of Masked Hero. Today's KevinMD article is Dependent on a Mask My Great Grandfather Invented. Shan, we can end with maybe a few sentences on how you would like us to remember your great grandfather and then end off with some take-home messages.
Great, thank you. Yes. So I think the take-home message one is that public health measures do make a difference. So I think with some amount of small sacrifices on the part of the individual, we can impact, epidemics, and it just takes buying in as a community to care for one another. Two is I would like just to have more stories about representation that include representation of Asians and particularly East Asians as heroes. I just don't see a lot of those stories, and I largely wrote this book for my children to be proud of their heritage and to be proud of who they are in terms of where they come from and just, that they have and their ancestry and their race. So I also think that things like silver linings can come out of things like COVID, which was all difficult for everyone. But there was a lot of, I think, finding a passion project, finding a way to deal with all the stress of being in COVID as a
Yeah.
physician and being an emergency physician, that this was really a passion project, which I applaud you, Dr. Phil, for like really highlighting how people can thrive in
Yeah.
careers in medicine despite really enormously difficult circumstances like epidemics or just the way that medicine can be really difficult, that you do really need to find these passion projects. And that's really what this book was about for me was wanting to spread those ideas and those messages, but also really as a way that I could deal with what was going on in the world in terms of COVID and all of the racial tension.
Shan, thank you so much for sharing your story, time, and insight. And thanks again for coming on the show.
Thank you so much. It's quite the honor, and just really so pleased that that we could share this story with you.